Well, hello and welcome to today's Facebook Live Ask the Experts program. The title is Masks Are Coming Off, but what does this mean for me? COVID-19 and the immunocompromised. So my name is Jennifer McClendon, and I am the Education and Mission Program Senior Manager here at NOCC. And we are delighted to have with us today Dr. Nita Lee, Associate Professor of Obstetrics and Gynecology at the University of Chicago Comprehensive Cancer Center, and also one of NOCC's Medical and Scientific Advisory Board members. Thank you, Dr. Lee, for being here with us today. We really appreciate it.
Thank you so much. Good topic.
Yes. So, there was recently an article published last week by Vanderbilt University that stated the great unmasking of America is in full swing, even as new COVID variants are beginning to spread, leaving many immunocompromised people wondering, hey, what about me? And so some experts say that, these relaxed mask guidelines are creating particular problems for the immunocompromised, including cancer patients who are especially, as we know, susceptible to contracting more severe cases of COVID-19. So we know that there are a lot of questions for sure. So thank you for being with us here today as we tackle some of these questions that I'm sure a lot of our audience is curious about today. So what about this, Dr. Lee? So what about these relaxed mask guidelines?
I think this is a really important topic because I think everyone is coming in talking about it. We're talking about it amongst our family members, about, with our patients. And obviously, I always put this out there that you really do want to talk to your doctor specifically about what is your specific immune compromised situation? Are you somebody who is a long-term survivor and maybe your immune system is probably about the same as everybody else's perhaps, or you've had a lot of treatment or you're on active treatment. So a lot of the recommendations may change with where you are on that spectrum. And so that's really important to take into consideration just as an overview. So we'll go over some major things, but I think a lot of it has to do with how do you understand your risk? What are the things that we can do? I mean, obviously, really thinking about social distancing when you can, mask mandates, yes, they are no longer required, but there are many people who feel like they're still wearing masks when they're in public, especially in indoor spaces or especially in crowded indoor spaces. There's some people who are choosing not to eat in indoor spaces still, and now that it's spring and summer, there's more options. And so a lot of it varies with each individual's person's sort of decision about it. I don't think I have a set rule oh, as a cancer patient you can never do this, right? We have to kind of figure out how to individualize it for everybody.
Sure. No, I appreciate that very much. That makes a lot of sense. Very individualized. So one of the questions we kind of wanted to maybe start with is just a little bit about the immune system. How are immune systems affected by cancer treatments, and how does that make us most vulnerable?
Yeah, I mean, I think when we think about most cancer therapies, especially for ovarian cancer, we're thinking about chemotherapy. And we know that most standard chemotherapies, one of the biggest way they affect the immune system is by affecting the bone marrow. So the bone marrow can be affected. You may have low white blood cell counts during chemotherapy cycles, and your providers may even call you and say, hey, this is a more vulnerable time for you. But even without those subtle changes in a real drop in your white blood cell count, we know that cancer patients in general may be, especially on therapy, may be at a higher risk because their immune system is blunted because of the side effects of the cancer treatment itself. And so that's kind of a known entity. We also know that this may affect how people respond to the vaccine in terms of do they get as much of a response?
Right.
That has been a concern as well. And one of the reasons that we've talked about boosters for populations too.
For sure. So what would you say that we may have learned in the last 2 years? Because I know you gave a talk to us about COVID about just 2 years ago,
2 years
when
ago.
everything was starting.
Yeah.
So in the last 2 years, in terms of patient safety, has anything really changed, or is it the same?
I mean, obviously, I think we're in a much better place than we were 2 years ago, largely because we know a lot more that this is actually something that is not necessarily I'm not as worried about wiping my groceries down anymore, right? Compared to just being aware of my surroundings and in terms of being in crowded spaces. So I think masking and good hand hygiene with hand washing is still very recommended. And it's probably the best way to be, protected when you feel like you may be in a vulnerable situation. We just may not be able to control if like other people are wearing masks, right? So
That's
there
right.
is kind of a whole slew of information and a slew of really advocacy suggesting that maybe that maybe the US is opening up too quickly, but it's very hard to gauge that on a, community level or a local level as well. So I think things have changed largely because we have a vaccine available, and we know
That's
that the vaccine and those who are vaccinated are not dying of COVID-19 or being hospitalized. And so that has really shifted the game in terms of
sure.
how frightening it was 2 years ago in March of 2020 versus now. It's still scary for some people and still scary for our patients, but much better circumstances, I think.
So speaking about the vaccines, what would you say that patients need to know now about the COVID vaccine, specifically in terms of those that do have cancer?
Yeah, I mean, I think it's something that's recommended for
Yeah.
patients who are on therapy, patients who are finished therapy, and any of us, all of us need to be thinking about the COVID vaccine and getting it. Most recently, just this week, it was actually recommended to consider a second booster. So for some people, this would be their fourth shot. When the boosters came out, patients who had immunocompromise, especially those over 65 or even 50 with other conditions, were considered eligible for boosters even before the general adult population was. Now it's time for our next booster potentially for some patients. And so this is something to think about and to talk to your doctor about as to whether or not this would fit with, when you're getting your treatment and how you felt about that. And so I think that's the biggest message, is that this may be something that we get a lot of immunity and help from the vaccines, but it may be eventually something like the flu where we're supposed to get it every year. The vaccine, that is.
Okay. Okay. All right.
But it's safe, and we feel like it's been well studied in a large population of patients, and so I think it's important to kind of know that that's out there.
Yeah, and one of the questions we get about, after vaccination, we've gotten a lot of questions from our community about wondering, after vaccination, is it still important for me to wear a mask? Is it still important for me to wash hands and social distance? I think we
This
know
is
the
a great
answer to
question.
that,
Like,
but
I wish I could come up here as an
I
expert and
know.
say, okay, well, this is the answer and this is how we should do it. But I think, I probably am a little more conservative with patients who are on active therapy,
Yeah.
or patients who have been on a significant amount of therapy where maybe their doctor has said, hey, yeah, you are actually more immunocompromised. And maybe we are lesser with patients who are off therapy now and are, planning trips that they had to put on hold for a long time. But things like still wearing your mask on airplanes is something that I do, thinking about masks in really crowded scenarios, and just being conscious of, symptoms, and making family aware of that too. So really want to know, like, really all of us should be responsible. Like, don't go somewhere if you have a fever, get tested.
Right.
Their tests are much more easily available. You'd be surprised by people who are saying like, well, my so-and-so came over and then they told me that they tested positive that day. And, like crazy situations that you just want people to be really responsible, and to not be afraid as a cancer survivor to say, hey, I still need to look out for my well-being. And hey, just
That's
checking
right.
with you. I know you know me well, but I'm assuming that you haven't had any COVID exposure, those kinds of things. And they may feel
That's right.
uncomfortable, but may still be needed.
That's right. It's been very eye-opening to me to really understand that people just don't, some people in the general population just don't get it, that they still have to think and be
Yeah.
careful for, they, protecting those that are out there that may have these conditions.
Right. And I think
That,
unfortunately the burden falls to our patients and our,
it does.
caregivers to kind
It
of
does.
keep that, still present, that, hey, even if you're feeling fine and you're doing fine and you may not need to mask anymore, think about which environment you're in and whether or
That's
not
right.
that'd be appropriate. I mean, I feel like there's a mask etiquette, right? Like we show up at somebody's
Yes.
house and we're like, oh, so do you mask? Do you not mask? Like, what is it like? And so there's kind of a way that we have to think about what you would want in your own home and how you would
Absolutely.
behave when you're going out in public, I guess. And in the
Absolutely.
hospital and clinics, we're masking completely. And I don't think that's going to go away.
No. Yeah. Right. Right. So if someone was to get COVID and say they are in the midst of treatment, what would you say to that person? What are they supposed to do?
Yeah. I mean, I think it's, when they're in active treatment, really talking to your care provider and your oncology team to really tell them like, hey, this has happened. Like for our patients, for example, if somebody said I tested positive, I'd be like, okay, well, we need to make sure, that you're not having any symptoms that require any further workup. We need to know that you have access. There are drugs that, can be administered to kind of diminish the risks of COVID as well. And I don't want to get into a lot of those details, but those are things that we can think about, right, for certain patients.
Yeah.
And so it's important to kind of like let your team know so that they can kind of direct you if you needed. Probably a delay in the chemotherapy. Like if you get diagnosed that week, you're probably not going to get chemo for that week or even the week afterwards. It'll depend on when you clear potentially your COVID, meaning like your symptoms resolve. And it may depend on like any long-term symptoms or any, a balance between not delaying your therapy too much, but still making you feel that you're feeling well enough to get your treatment.
Perfect. 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 And speaking about a susceptibility to COVID, does having a cancer diagnosis affect one's susceptibility to getting COVID? Or what about the severity? I think I've read that it really affects more of the severity of COVID.
Yeah, it definitely can affect more of the severity. I mean, pre-vaccine, we definitely saw some of that initial data coming back, but it was also for specific cancers too, in terms of the type of chemotherapy. Unfortunately, patients who have to have even more aggressive chemotherapy or bone marrow transplantation may be at the highest risk groups. And ovarian cancer patients may be in that middle range group that they are getting cytotoxic chemotherapy, but it may not be affecting their immune system as drastically. So then it would really vary between each individual person's immune system.
Yeah.
I think that kind of varies a lot. So they may be more susceptible and maybe more susceptible to severe disease, but the vaccine actually helped blunt that a little bit.
Yeah. Speaking of immune system, we have a question in the chat that's going on about how would an individual really know that they are immunocompromised?
Yeah, that's a good question. Sometimes the only thing that we do is kind of check white blood cell counts, right, in general. But that's one of the more obvious ways. Definitely like not having a spleen or having a splenectomy as part of your surgery. You're somebody who may need all the other vaccines every year as well, right? So making sure that that may be somebody that's a little more immunocompromised than average, right? There's not one single blood test or measure for immunocompromise. A lot of it is really based on like what your chemotherapy track record has been, how your blood counts have been, and otherwise your overall health, like your age matters, your weight, other medical conditions such as diabetes can make you more at risk for infections. And so it ends up being sort of a spectrum, and it may not just be like one way that we can say, okay, I am this much immune compromised compared to, person A.
Got it. Okay. Yeah. Another question we got when you were talking about the booster is, when do I get the fourth booster when I am on active chemotherapy?
That's a good question. I personally just give people the booster and I tell them to plan it around the time, like if they want to plan it like a week before their next chemotherapy cycle, because they don't want to feel like the overlap of symptoms. If you're sort of at the end of therapy, some providers really say, okay, well, wait till your chemotherapy, this is on your last cycle, wait till that's over. But I feel like I think what we've done really has been to standardly just offer that at a time that's convenient for people. So we've given it on some days where it's the same day as treatment, and people have said, oh, look, my last two were fine. I didn't have any symptoms. I'm just going to get it the same day because I don't want to come back. So I would talk to your provider specifically about when to time that.
Okay.
Yeah.
Good. Thank you so much. And moving on a little bit more to talk about, the process changes that we've experienced to our medical visits, our procedures, our treatments, our timing, and all of that. 2 years ago, for a while, we know things have been canceled, delayed, gone virtual, but things have changed and shifted, like you said. And so is there anything new at how this looks now, or is it pretty much still the same? It probably
again, I think it's a good question. I feel like we learned a lot. So I think we definitely used telemedicine and telehealth, like video visits and phone visits and remote labs a lot more at the very beginning, because we were terrified to expose our patients when we didn't know. So now we're trying to see, can we integrate those things that were helpful to kind of really better patients' quality of life? To say do I really need to see somebody if I think their labs are fine and they're doing very well on a standard treatment? Do I need to see them every 3 weeks, or can I see them every 6 weeks and they can just go straight to their infusion center, right? So, and it's not because, it's largely because time spent waiting in our office or waiting in the waiting room and getting checked in and another visit. And so we've tried to incorporate more telemedicine. We've tried to include continued referrals to sort of the tremendous amount of online resources. For NOCC, for example, huge growth of what's available. We've really tried to train more patients on how to use it, which I think is helpful.
Oh, that's great. Yeah.
And then otherwise, I think each hospital has its own limits on how many people can come with you, and the importance of still trying to figure out how you're going to get all of the information you need is still a struggle sometimes, but less so than it was.
Yeah. And so, what else? I know this might be a hard question to answer, but what else do you think patients and caregivers might need to know about? What else can they do to protect themselves beyond masking, beyond the vaccines, like to help their
Yeah.
immune system? Like,
Yeah, I mean,
what?
those are great topics. I mean, those are topics that I think transcend whether or not you're a cancer survivor or a caregiver. It's probably really good for all of us. I mean, I think there again, there's no magic supplement that's going to boost your immune system. There's no magic way to kind of think through, okay, if I just do this. But the basic tenets that people talk about are really starting from the basics, right? So thinking about like your diet quality. So again, not one specific food, but thinking about a range of foods, less processed foods, if you're able to, more fruits and vegetables. Some people can't because of chemo and radiation constraints, but just balancing that out.
Yeah.
Thinking about getting your natural immunity and natural antioxidants as opposed to a tablet sometimes.
Yeah.
Sleep is very
Sleep.
underrated in terms of the effect of your immune system.
Yes.
Exercise, and it doesn't have to be like, oh, run a 5K, just any type of like, moderate to mild exercise, walking, stretching, yoga, all of those things can really help boost your immune system. And then, just kind of stress reduction. And the stress reduction can come in many, many formats, right? So there's a
Right.
lot of different, like, well vetted ways to think about stress reduction, and you have to kind of find which way works best for you.
Yes, absolutely.
I think those are kind
Um,
of the major things, like the major areas that I think about for patients and for
okay, great.
myself.
Yeah, great, great.
Yeah.
We have another question that came in through the chat more on the psychosocial side of things. And so I wanted to
Sure.
mention that we're going to have an Ask the Experts of next month is going to be focused more on the psychosocial aspects and the way people have coped with their diagnoses, with their treatment during this time of isolation, during this
Yeah.
time of just change. And so we're going to have a panel of both survivors and caregivers who've been on the extreme. We're going to have those that are more out in the world and feel more comfortable to do so. And then we're going to have someone that's going to talk to, I can't go anywhere because of my situation. So we're going to talk about the mental and emotional side effects that this whole change has
Yeah.
really brought and how to cope with those. But one of the questions we did get just now was, how do you bring up the COVID conversation with family and friends in a nice
Yeah.
way?
Yeah, I mean, I think it's
But
so true. And I do think that because things are shifting to opening up, unfortunately, the onus comes on the
yes, it
patient and
does.
the caregiver team.
It
Or,
does.
and so I do think it's a way of saying, like, hey, this may be, I know this is happening. Like, I know that, my body may not be as different. You don't have to, bring it up in terms of like more too much technical details, but just to say, like, this is what I've decided. I really do need to ask these questions just for my own safety. I'm assuming you haven't had any COVID exposures, but just kind of placing it in like, because a lot of people, friends and family probably want to feel like they're doing their best to like support survivors and their caregivers. But this may be a way of saying, like, shifting that and saying, hey, the best thing that could be supportive is for you to, like, just make sure that, like, you're being aware of your own contacts, like, don't come and visit me if I'm sick, or those kinds of things. So bringing it up sort of like a gentle, like, hey, within my care space, what I need now is going to be kind of attention to this because the world may not be as paying as much attention, right? So I think
Right.
that's kind of a way to think of it, and trying to think of it. And some people are just like, hey, like, these are the rules of my family, like, this is what we've
Yeah.
decided to do, and like, and that's okay, and being a
And
little
it's
bit not
okay.
afraid of saying that.
And yes, exactly. And it is okay.
Yeah.
Absolutely.
Flip side, I would say that there are a lot of caregivers who are like terrified that they're going to give COVID to their family
Yes.
members, to the point where they're like not
Very
coming to see
stressful.
them, or they don't want to have their grandkids come over. And I do feel like in the age of like vaccines and like lower percentages of COVID, I think that really needs to be addressed in terms of like, we can't keep everyone in a bubble, because quality of life and those interpersonal relationships, like, you don't want those to be like really lagging. And I think I've really tried to counsel my patients of like, it's okay to have your family over. It's okay, or daughters who've said, or kids who've said like, oh, I don't want to bring my grandkids over to my mom's house because of XYZ. But I'm like, well, your mom's off therapy. There's nothing to do, and so I think just making sure we're aware of that.
Yeah. And for those, I also wanted to ask for those that are more active, that may be in treatment still and still working and have kids at
Yeah.
home and all those kinds of things. And actually, one of the questions that just came in as well, where my kids are in school now with no mask requirements. My
Yeah.
children are still wearing masks, but how, may not be able to answer directly, but how can we make sure that they're being safe in school is to not bring anything home? That is a very common question that we get.
Yeah, no, I mean, I think we have to trust that they're going to wear their masks, and kids are extremely resilient about doing that. I don't think they're as bothered as everybody. I think the adults are bothered by the kids in masks, but like my own kid, like often wears a mask, and I have to tell her, like, you're outside, you can take your mask off. And she doesn't, like, it doesn't, like, so I think if kids are wearing masks and because they're trying to protect, a loved one or a caregiver, then I think, good hand washing when you get home, making sure they have like good masks that they can exchange if they're physically active, those kinds of things can be helpful. Talking to the teacher sometimes to just kind of make sure that they've normalized, like, some people wear masks, some people don't wear masks, and that's reinforced is probably really important. So that may be a good educational, opportunity for the student's teacher to be like, hey, like, we all have someone at home that may be affected more. And this whole idea of like, can we do our part, I think still needs to be emphasized. And I think kids will pick up on that too. I think it's
Yeah.
more,
Yeah. How can someone keep track of local COVID rates?
I think that there are so many websites. Like if you start with like the CDC website,
Yeah.
the New York Times website also has this, and each state usually has like public health departments that will actually really give you like your zip code as well. So there's a lot of different ways to kind of like essentially like Google COVID rates in your county, and you'll be able to find that. Some places have like daily or weekly updates, and some places have more of like a, they'll kind of give you a broad spectrum, but some of those major websites actually have like essentially like at
State
least
zip
50,
code.
like state zip code, those kinds of things, because that's the level that the public health teams are keeping track of COVID right now.
Yeah.
And so keeping track of that percentage may be important, because you may say, oh, look, things are ticking up in my neighborhood or in my county. I'm going to go back to not eating out indoors, and I'm going to wear masks in the grocery store, and, or something like that. You may change your behavior based on what you see.
Yeah, absolutely. I mean, it's a lot of information. I know these 30-minute sessions, they fly by so fast. And before we close out today, because I don't see any other questions coming in, but any other last words that you would like to maybe say as far as like, this topic or
No, I think so. I mean, I think it's a really important topic, making sure you're kind of aware of your own risks, not being afraid of kind of standing up for your own,
that's a good message.
like sort of advocating for like what you need to do to keep safe or to feel safe, but also recognizing how important those social interactions are. I will say, I was telling you before we spoke, like we studied this in our own patients, and I'm happy to share at some point our paper that we wrote looking at resiliency, and we found that a lot of our ovarian cancer patients were extremely resilient despite the COVID-19 pandemic. It's not to say that things, aren't tough, but we also know that this is a group that, as we've learned from as providers and, as advocates, this is a very resilient group of women who've had to deal with a lot of uncertainty. They've had to kind of make these adjustments to their lives, whether it's work life, home life, those kinds of things. And so that sort of, I think, will continue, I guess. I feel like a lot of our cancer patients and survivors may actually be able to kind of lead us along this way of how to kind of to do that. So I think that's really important to kind of keep in mind, and to think of like there are a lot of vulnerabilities, but there is a particular amount of strengths that I think that this group has. So
well, you are definitely an expert in this area. We appreciate your time. You've answered a lot of great questions that we've had and that we've gotten from our community. So we really appreciate it. And we'll dive into this next month more on the way on how to cope with these challenges from a mental and emotional aspect. So again, we just appreciate your time today so much. And we look forward to next month's session, everyone. So thank you so much for joining us.